Today is World Restart a Heart Day, and this year the state of Florida passed a new law to make public schools more heart safe. Here to tell us more is Stacy Comerford, Executive Director of the American Heart Association Palm Beach County, and also what parents should know about their child's heart health. We have pediatric cardiologist Dr. Danielle Kahn from Nicholas Children's Hospital. Thank you both so much for being here with us this morning. Stacy, we'll start with you. Let's talk about this legislation that was passed that went into effect for people that aren't familiar with it.
Sure. Well, this legislation was designed to make schools safer for anyone on campus that may experience a sudden cardiac arrest. And there are three main parts to the legislation. The first part is that students will be trained in basic first aid and CPR skills once in middle school and once in high school. The second part is that there needs to be a written plan in place that includes CPR and AED training for certain faculty and staff so that people know what to do in the event of a cardiac emergency. And then the third part is that every Florida public school, including charter schools, needs to have an AED on site that is maintained regularly.
We also have a new law that was also passed about just EKGs when it comes to student athletes, and that they must have one now before they even take the field. So Dr. Kahn, what do parents need to know just about heart health when it comes to their children? Because unfortunately, some of the students who have died here in our state, the parents say they were healthy to their knowledge. They had no idea that their child had a heart condition.
So generally speaking, for your heart health, all of us need to watch our diet. All of us need to make sure that we are not overweight. The general recommendations for exercise for school-age kids is an hour of aerobic activity 5 days a week. So I think all students should be in after-school sports. Otherwise, there's no way that you're going to get an hour of activity in. As far as symptoms go, typically the thing that we watch out for is chest pain with exercise, palpitations with exercise, or if they're complaining of anything related to the heart, then they need for their doctor to check them out.
Stacy, why is it so important for the American Heart Association to be involved in the schools?
Well, when it comes to CPR, our goal is to have a lifesaver in every household. We know that children as young as 9 can perform CPR, so every time a student is trained in CPR, we're putting an additional lifesaver into the community.
Dr. Kahn, do we often see cardiac emergencies in schools?
So it's estimated that in the United States of America, there are 10,000 to 20,000 cardiac arrests in kids. So it is quite frequent. Nicholas Children's Hospital that's a very high number, higher than what we would have thought. Yeah. Nicholas Children's Hospital has trained the Miami-Dade and Palm Beach schools to have a CPR team and to have working AEDs in place. Since we have done that in the last 3 years, we've had 10 arrests. 5 have been in kids, 5 have been in adults. Since there are teachers there too, about half of the arrests have been in adults. Our resuscitation rate has been 90% in these 10 people. It's estimated that if you don't have a CPR team in place, then the resuscitation rate is about 20%. So it makes a big difference to know people how to do CPR and to have a working automatic external defibrillator close by.
Definitely wonderful to see those numbers changing, and also just to raise awareness like this. Hopefully those numbers decrease even more. Thank you both so much for being here talking about such an important topic. If you would like to watch this interview again or for more information, you can head to our website, WPBF.com, or download our free WPBF 25 News app. Vanessa.
Hi, good morning, Nathalie.